Hey everybody, it's Mr. Yago.
Hey, how you doing?
I'm gonna go through a just a little quick screencast on the anatomy of the heart as well as the blood flow, so you can at least identify where does oxygenated blood come in, and where does deoxygenated blood go. So I'm just gonna kind of go around and to the best of my ability quickly identify all of these parts. So number one, this is your aorta, specifically the ascending aorta. And that's going to take blood right out of the top of the heart. This is going to be oxygenated blood. This is going to go up to the head, which we'll talk about in a little bit. Next up, this is considered the superior vena cava. So let me get number 2 up here. Superior vena cava. This is a vein, and that's going to bring deoxygenated blood back to the heart, especially up from the head and the neck and the arms. Number 3, you got to kind of get in the map. Technically, this is anatomically right. This is anatomically left. This artery is coming. Arteries always go away from the heart. This one is coming off to the right. This would be considered the right pulmonary. Let me start and get number 3 in here. Right pulmonary artery. Pulmonary is basically identifying the fact that it is going to be going to the lungs. Number 4, which is right there, it has 2 that it's pointing to. These are the right pulmonary veins. And the reason these are veins is because this is actually coming back to the heart. So you can imagine the lungs are actually on both sides. This brought blood to the lung. If the lung was here, number 4 is bringing blood back. So I'll keep going here. Number 5 is pointing to one of our very first chambers here. This is your right atrium at the top. And underneath that, number 6, we'll classify this as the right AV valve. If you guys were doing some Googling, you might have come across words like tricuspid, bicuspid, mitral. We're going to keep it pretty simple and just identify them as AV valves. That just means they're between the atrium and the ventricle. So number 7, I'll slide in number 7 here. This would be considered the right ventricle. And while we're on the topic, this whole right side of the heart is considered the pulmonary side. This is all going to be deoxygenated blood. And what that means to you is it's already been to the body. It's already used the oxygen to give to the body. So it's usually bringing CO2 back and waste back. And this right side of the heart is going to pump out to both the lungs. So let's keep going. Number 8, which is sitting on the bottom here, this is the inferior. Let me get number 8 up here. Inferior vena cava. So, inferior vena cava. Sometimes they pronounce it cava. And that's actually going to bring deoxygenated blood up from the lower extremities and the legs. So basically 8 and 2 are going to come together back here. This bringing deoxygenated blood from the legs, this bringing deoxygenated blood from the head. So that's the whole right side of the heart. Let's jump over to the left side of the heart here. Number 9, if you look, these are both pretty much the same thing. So 3 and 9 are the same thing. The only difference is you need to identify the anatomical position. And are the pulmonary arteries, but this is specifically the left pulmonary artery. Okay. Let's keep removing here. That means that number 10 has to be the left pulmonary veins. It's giving me a complex that's capitalized. My apologies. Moving right along, this is the opening on the left side of the heart. So number 11 would be your left atria, which is a chamber for blood to enter. Number 12 is going to be your left AV valve. A little quick hint about valves. Valves are put in place to prevent any type of backflow. So this valve is going to close shut if blood tries to go backwards here and here. And actually, anywhere there's a valve. We have valves in our veins, which run through our body, but especially in our heart. Number 13 is pointing to a valve right here, and this is actually going to be your aortic valve. It's tough to see, and we'll see it better when we dissect a sheep heart, but this is actually going to sneak behind here, and this is considered your aortic valve. You might have identified it as something called a semilunar valve, but it is considered an aortic semilunar valve, but we'll just call it the aortic valve. Then this big opening down here would be your left ventricle. Let me get that up. Number 15, see if we can sneak it down here. I think we're good. Number 15 would then be your aorta of the descending variety, which would mean it's going down and bringing oxygenated blood. So actually, if you watch up here, I'll draw out later, it's going to go boop, behind the heart, and this is going to send oxygenated blood down. There's one thing that is not labeled in here, and I'm going to do my best to, I'm actually going to put it down here, and that is number 16. And that's pointing to this valve right here. This is your pulmonary valve, because that's part of the pulmonary side. And what I'm going to do is I'm just going to go like this, because this is probably what you guys have. Ooh, that's big. We're going to make that a little smaller. I'm going to put that right there. Hopefully you guys can see that. Let me bounce back for a second. Good. So that's 16, just so you guys kind of have an idea of where that's located. It's pulmonary. So these are all the anatomical parts you need to know for the quiz that's happening tomorrow. Again, the biggest issue we see is people not memorizing. If you go to the Canvas homepage, I also have a quick little quiz to get the anatomy. Now, the one thing that I will not put on this quiz, but you will need to know for the test, is how blood flows and when it's oxygenated, when it's deoxygenated. So what I'm going to do is I'm going to kind of, we'll go to a crayon. How does that sound? All right, cool. Let's do it. I'm going to start with making this blue. So let me get blue out here. We'll use this. Yeah. There we go. Hopefully this doesn't look like crap. But I want to let you know that when blood is coming back to the heart, it's going to be deoxygenated. So it's either going to come up this way, and this is your superior vena cava. I already don't like this crayon. We're going to click back out and do something else. Let's do the pen here. So let me get the fill color blue. So this is your inferior, vena cava. And what this is going to do is bring deoxygenated blood up from the legs and the midsection of the body. It's going to meet the superior vena cava here. And then one of the first things you're going to see is a bunch of deoxygenated blood pool right into the right atrium. A heart has two sounds. It has a lub and a dub. The boomf. So the first boomf is going to be blood moving into the ventricles. Okay, and this is still deoxygenated. And as the second part of the heartbeat, so the boomf or the lub dub, is when blood is going to move out of your ventricles. Now the lub dub is a louder sound because these are bigger spaces, and what's happening is blood is leaving the heart in a larger quantity. So when we listen to a heart up, ba-boomf, 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 the boomf at the end is always a much stronger sound. So what this is going to do is it's going to send deoxygenated blood out. This will be your left pulmonary artery. It'll also send it out here. I'm going to try my best to just kind of show you, and then it's going to go out that way. Now that is going to bring blood out to the lungs, and I'll write it out here. We got a lung on both sides. I'm not going to I'll try and sneak it in right here. We'll just put it right here. Lung. Sorry, terrible penmanship. And now we are going to be bumping out to red. So what's happening now is we are going out and going to the lungs, and we are now oxygenating. So here and here, I'll just start here. We now have oxygenated blood. Now, our deoxygenated blood is not blue. I'm just using this as an example. But I will tell you this, oxygenated blood is very, very bright red. So blood that's in the lungs will be bright red. Now, these are your pulmonary veins. We have a right and a left, and these are coming from the lungs, which are right up here. And once that enters, it's going to enter right in here into the left atrium, and that's going to move down to the ventricle, and that is then going to get pumped out of the heart. I'm going fast because I have about 10 seconds left in the screencast. So that will then send blood throughout the whole entire body. Any questions, I will do my best. I know this week's kind of crazy, but I will do my best to answer them, and hopefully you'll have a handle on this for your quiz tomorrow. Again, just the anatomy tomorrow. See you guys.